Alright, the sixth cranial nerve, also known as the abducens nerve. Like its name suggests, it is involved in the abduction of the eye. Okay, so if you want the eye to get abducted, this nerve must supply the lateral rectus. Very good. Okay, lateral rectus muscle. So how does it abduct the eye? It is basically responsible for lateral gaze. So how does it exactly does it abduct the eye? Like what are the neural controls for it? Let's see. This is the sixth nerve nucleus, which is located somewhere in the pons. Okay, imagine this is the sixth nerve nucleus. This is the sixth nerve nucleus, and it is actually connected to something called this. This is called the PPRF, or the paramedian pontine reticular formation. Some people even argue that the PPRF is actually a part of the sixth nerve nucleus, but let's say, okay, it is maybe a part of it. Let's imagine if it is or if it isn't. I'm not arguing. Okay, so how does it control the lateral gaze? Let's see. Now, in the frontal lobe of the brain, over here, in the opposite lobe, the contralateral frontal lobe, is something called the frontal eye field. This frontal eye field sends signals to the opposite PPRF, which then controls the lateral gaze over here, which then supplies the lateral rectus of the same side like this. I've drawn a figure over here just to make it easy for you to understand. So this eye will actually start pointing this way. Okay, this eye is gonna start pointing in the lateral gaze like this. Okay, so how will, okay, this eye is gonna move laterally. Technically speaking, this eye should also move like this in order to make sure the vision doesn't get distorted. So how is this achieved? You always know that both eyes move at the same time in conjunction with each other. So how is this achieved? Actually, the PPRF and the sixth nerve nucleus of this eye is actually connected to the third nerve nucleus, so in the midbrain, right over here, to something called a median longitudinal fasciculus, MLF. Okay, so as soon as this nucleus is fired, the third nerve nucleus over here also fires, and the third nerve controls the medial rectus muscle. So both eyes will point towards this side at the same time. Okay, understood? Okay, what can happen if the sixth nerve nucleus goes wrong? Something happens to the sixth nerve nucleus, and let's say if there is an Abducens palsy. Okay, Abducens palsy, palsy. And this is definitely not the ab I'm talking about. This is definitely not the abdominal muscles. Okay. Okay, so an Abducens palsy, what can happen? Failure of abduction. This person will be looking like this over here. Okay, it's something called a medial strabismus. Result is something called a medial strabismus. Strabismus. I'm not writing this entire spelling over there. Just imagine medial strabismus. Okay, this sixth nerve is actually the most commonly damaged nerve in the CNS for a few reasons. Why? One thing, the sixth nerve follows a very, very tortuous and a very stressed and a very tensed out course when it leaves the pons and it enters the eyeball. It follows a very, very stretched course over the cranial bones and everything. So anything which goes wrong in the skull, like for example a rise in intracranial pressure, this nerve is the first to get compromised because of its course, anatomical location. Okay. Secondly, the sixth nerve is also located right in the center of something called the cavernous sinus, right in the middle of it. So anything which goes wrong in the cavernous sinus, the sixth nerve is always the first one to get compromised. Let's say a cavernous thrombosis. Okay, a cavernous sinus thrombosis. The sixth nerve will be the first one to get compromised because of this location. As a side note, what can happen if this medial longitudinal fasciculus gets damaged? Imagine this getting damaged over here. The person is gonna look alright, but as soon as you ask him to move his eyes like this eye will go like this, but this eye will not follow. Okay, the medial longitudinal fasciculus is damaged in conditions like Multiple sclerosis, the most common condition to damage the medial longitudinal fasciculus, is a demyelinating condition which can damage the MLF, and this is a classical manifestation of the MLF damage. One eye goes points laterally, the other eye fails to follow. Okay, and this concludes our lecture on the sixth nerve and its lesions.